Welcome to DocFit Media. In this video we'll talk about hair fall or hair loss. Hair loss alopecia can affect just your scalp or your entire body. It can be temporary or permanent. It can be the result of heredity, hormonal changes, medical conditions, or a normal part of aging. Anyone can lose hair on their head. Baldness typically refers to excessive hair loss from your scalp. Causes: people typically lose 50 to 100 hairs a day. This usually isn't noticeable because new hair is growing in at the same time. Hair loss occurs when new hair doesn't replace the hair that has fallen out. Family history, heredity. Most common cause of hair loss is a hereditary condition that happens with aging. This condition is called androgenic alopecia, male pattern baldness, and female pattern baldness. It usually occurs gradually and in predictable patterns. A receding hairline and bald spots in men and thinning hair along the crown of the scalp in women. Hormonal changes and medical conditions, including hormonal changes due to pregnancy, childbirth, menopause, and thyroid problems. Alopecia areata, alopecia totalis, alopecia universalis. Medications and supplements. Hair loss can be a side effect of certain drugs, such as those used for cancer, arthritis, depression, heart problems, gout, and high blood pressure. A very stressful event. Many people experience a general thinning of hair several months after a physical or emotional shock. This type of hair loss is temporary. A family history of balding on your mother's or father's side. Aging. Significant weight loss. Certain medical conditions such as diabetes and lupus. Stress. Poor nutrition. Prevention. Most baldness is caused by genetics, male pattern baldness, and female pattern baldness. This type of hair loss is not preventable. These tips may help you avoid preventable types of hair loss. Be gentle with your hair. Use a detangler and avoid tugging when brushing and combing, especially when your hair is wet. A wide-toothed comb might help prevent pulling out hair. Avoid harsh treatments such as hot rollers, curling irons, hot oil treatments, and permanents. Limit the tension on hair from styles that use rubber bands, barrettes, and braids. Ask your doctor about medications and supplements you take that might cause hair loss. Protect your hair from sunlight and other sources of ultraviolet light. Stop smoking. Some studies show an association between smoking and baldness in men.